So I'm just going to start out by feeling here. You have any pain?
Nope.
Okay. Shoulders?
Nope.
Okay. You can just put your arms out for me and flip them. Perfect.
No pain.
No pain? Okay. Now I'm just going to have you turn this way. Any pain in your fingers?
Nope.
Okay. Everything seems good so far. Okay. And then I'm just going to have you put your legs out a little bit more if that's okay. Yep. Perfect. Any pain over here? Okay. And then your feet, your ankles? No? Okay. Great. Great to hear. Looking good so far. Now I'm just going to have you turn just a couple ways, see if anything feels weird, anything like that, okay? Okay. Just gonna put on some more hand sanitizer. Don't wanna get you all sick or anything, you know?
Thank you.
Okay. So first I'm just gonna have you look down, then face the ceiling and look up, then turn towards me, and then turn that way, and put your ear to your left shoulder, and then your right shoulder. Perfect. Any pain in there? Nothing? Okay, everything seems great down there. That's good. Okay, and then I'm just gonna pause for a second. And then if you could just raise your arms up for me. Yep. And then down towards the back like Superman. Yep, perfect. And then out to the side. And yep, up above your head and down. And then if you could put them behind your back like this, and then you're gonna raise them up. Okay. Any pain in the shoulder at all? Okay. Feel a little bit of popping in there at all?
Maybe a little.
Okay, but no pain?
No
Okay,
pain.
good. Glad to hear that. And then I'm just going to have you put your elbows out. Okay. And then if you could just go like this and then down on my hand. Okay. Wow, great. No pain at all?
No pain.
Oh, that's good. That's good. And then I'm just going to hold your wrists here. I'm going to have you point your fingers to the sky, and then down. Perfect. And then I'm going to have you turn your thumbs to your belly button, and then out. Any pain like that? Okay, got some popping over here, but that's okay. No pain in there?
No pain.
Good, okay. And I'm just going to have you put your fingers to the sky, and then make a fist. Any pain? Perfect. Everything feels good. That's great. Now for your knees, I'm just going to have you extend them outwards and then just put them down. Okay. Put them down. Okay, any pain there?
No.
No? Okay, good. This one feels a little bit of movement, but shouldn't be. It feels good. Everything's good. And then for your ankles, I'm going to have you raise your toes to the sky and then point them down and then put your soles in and out. Any pain there? A little bit of popping in both, but no pain at all?
No.
Great to hear. Great to hear. So now I'm actually going to do your strength test so I don't have you sitting up and down again. So, okay. Sit back down. So I'm just going to have you push down on my hands and then push up on my hands. Okay? Push. Perfect.
Strong.
Yeah, you're very strong. I would say that you are a strength of 5, which is great. That's the best one. That's what you want. And if you could do the same with your legs. Wow, strong. You. Okay, I'm just going to have you stand up and we're going to do some hip movements, back, just check out your spine a little bit. Is that okay? Of course. Perfect. Okay, so first we'll just check out your back. Okay, everything feels good here. You can just like go in like a backwards, like back bend movement. Okay, good. And then forwards. Perfect. And then you're going to do right arm to right leg, left arm to left leg. Okay. Good. Okay, and then if you could just twist backwards on each side. Okay, great. Any pain there?
No.
Everything feels good, so that's good. And then we're just going to do the hips. So basically what I'm going to have you do is you're going to kick forward and backwards on each leg, and then I'll give you the next one next. Okay? So you can go perfect. And then you can do the other leg. Perfect. I'm going to have you kick out to the side. And then in, across your body, and then with the other leg too. And then I'm going to have you do a high knee, and then out to the side and across your body again. Okay, and then the other leg. Perfect. Everything, anything in there? No. No? Great. Everything felt good. Back was, shoulders were symmetrical, everything like that. So great to hear. You can sit down so that we're do is the ocular motor nerve. So there's gonna be a bright light during this test. That's okay? Okay, perfect. So first I'm just gonna have to look and see what size your pupils are. I would say both your pupils are a size 2, which is great. Okay, perfect. So then this is gonna be the light test. So if you could just look over my shoulder, that would be great. Then one more. Perfect. Both pupils are perla, which means that they're equal in size, both responsive to each other, and there's a word that I'm missing. They're convergence and consensual with each other. Yeah, sure. Let's say that. Now I'm just gonna have you follow my pen with your eyes. Perfect. Okay, we'll put that there. So your ocular motor and your trochlear nerves are intact because pupils were convergent and consensual with each other, and you were able to follow, both pupils were able to follow me around with the pen. Then next I'm going to do your trigeminal nerve. So basically for this one, I'm just going to have to feel your face while you clench your teeth. That's okay with you? Okay, perfect. So you can clench your teeth. Perfect. Then one more time. Okay, perfect. Trigeminal nerve is intact because I was able to feel the teeth clench. And then I'm also going to have to do a sensory test on you for this one too. So I'm just going to touch a few spots on your face, and you're just going to tell me when you feel the touch. Okay, you close your eyes. Perfect. Trigeminal nerve was intact because you were able to feel all the spots on your face. So the next one that I'm going to do is the, what is it? Facial nerve. So I'm just going to have you make like a couple different faces to see if your facial nerve is intact. Okay? Okay. So the first one that you're going to make is you're going to blink your eyes really tight. Perfect. And then if you could raise your eyebrows. Perfect. And then if you could puff your cheeks. And then if you could smile for me. And then frown. Perfect. Facial nerve was intact because your face was symmetrical and you were able to make every single move that I explained to you. Then the next one is the acoustic nerve. So I'm going to have you face this way, and I'm going to have you cover one ear at a time, and then I'm going to whisper a word, and you're going to have to repeat it back to me.
Okay.
Okay.
Pizza.
And then you cover the other ear.
Ice cream.
Perfect. So your acoustic nerve was intact because you were able to repeat the word after I whispered it. So the next one is going to be the, I don't know how to say this word, nerve. Basically, I'm just going to use my light and the spoon. I'm going to have you stick out your tongue, open your mouth, and you're going to have to say, ah. I'm just going to check, see your uvula back there, and stuff like that. That's okay with you?
Yeah.
Sorry, this one. Okay. You could just say, ah. Perfect. Everything looks great back there.
I'm going to start with looking around at your skin. So I'm going to grab your arm and look under your bra and move your hair. And look on the side and look at this one. I didn't do general survey. General survey, patient is upright, patient is conversational, patient, it looks her age and is light pink, pale with a little bit of purple undertone, looks a little cold. And then I'm going to check your legs. So your overall skin color is pale with a little bit of purple undertone, and your skin is intact. I did not see any scabs. There is a scar up here on the below her left clavicle. Yeah. Okay. I'm gonna palpate your arms and your legs. So just lay your arms out the way we're fine. Sorry, my hands are a little bit cold. And then can you, or do you prefer me to take your shoes off, or do you like to take your shoes off? And your socks, please. This again, we're fine. So patient's skin is dry. It well, as it should be. Meaning it's not moist. It is warm. Have you had any pain so far? No. I'm going to. Could you take your hair out of your ponytail for me? Thank you. I'm gonna touch around on your head. Is that okay? Okay. Hair's soft. Thanks. Sorry, I'm messing up your hair. It's okay. You can go ahead and put your hair back up if that's what you'd like. So your hair is smooth. For texture, it's soft. It's thin, but there's no unevenness or patchiness, and there was no, your scalp integrity was intact. I'm gonna look at your nails, is that okay? Palpating them, they feel smooth, but I forget what the word is for it, but they're not brittle, they're bendable, and they're all the same shape. And then I'm gonna do your capillary refill, which was less than 2 seconds, which is good. At your arms and make sure that your integrity is intact. And it seems to be. I'm also going to take a look at your legs. Could you take your socks off for me? Or I can do it for you. Okay. So your legs. I'm sorry. Okay. So your skin is intact, and can you go ahead and put your arms out and just lay them on your legs for me? Thank you. So. Your skin is warm to the touch, but it is dry and it is smooth in texture. If you could lay back for me, and I'll pull this out to make it more comfortable for you. Is that okay? Yeah. Okay. I am going to find your femoral pulse, so I'm going to be touching in here, and at the same time, okay, your pulse is a 2+ bilaterally. Now I'm going to check your popliteal, so can I have you bend your right leg? for me. Or you can put it all the way down if that's more comfortable. Okay, and then I'm going to have you do the exact same thing on this side. Go ahead, straight and relax. Okay, so your cocktail pulse is symmetric with 2+, and I'm going to look at the pulse is on the top of your foot. I don't remember the name of it. Maybe it'll come to me. So can you go ahead and raise both of your big toes to the sky? Okay, and you can relax. Okay, the pulse was symmetric bilaterally and 2+. Okay, and then I'm going to do this one. Okay, and the medial tibial pulse was symmetric bilaterally with 2+. You can go ahead and sit up for me. And I'm going to take your radial pulse, so I'm going to be on your wrist. So can you move your scrunchie for me? Your watch is fine, just your scrunchie. Thank you. Okay, your radial pulse is bilaterally symmetrical, 2+, and then I'm going to do your brachial, so on your elbows, so if you could just extend your arms. Thank you. Okay, and then your brachial pulse is bilaterally symmetrical, 2+. Can I get you anything?
Okay, I'm going to be having you follow this pen real quick for me. All right, and I'm going to have you follow it in this direction. And just keep following it for me. All right, perfect. Next, we're going to be doing an assessment of the nose. I'm just going to make sure that your septum is midline. I'm not seeing any discharge, no vascular lesions coming out of the nasal passage, and your sense of smell hasn't been having any trouble recently, has it? Okay. Next, we're going to be doing an assessment of the lips, just making sure that your lips don't appear dry or cracked. I don't see any signs of cyanosis. And can you smile for me? Can you frown? Perfect. Next, I'm going to have you do a big smile for me. We're going to be assessing the mouth. So teeth and gums look good. And if you can open big for me, just lay that tongue flat for me, please. Just making sure your pharynx and tonsils look good. The tongue was midline. I didn't see any vascular lesions. I didn't smell any ammonia, no alcohol, no fermented fruit that could point to diabetes. And could you actually simulate a swallowing motion for me real quick? All right. Next, we're going to be doing an assessment of the neck. So first thing I'm going to have you do is, if you mind turning your head this way. I'm just going to be palpating your jugular vein for any distension. Other way, please. Any distension, any swelling, or any abnormalities that I need to observe. Just look straight ahead for me. Next, we're going to be palpating your cervical lymph nodes. Feel perfectly fine. I also noticed that your trachea is midline. That's great. And we're going to be doing a range of motion test on the neck as well. Turn your chin up. And if you can look down for me. And just turn your head left and right for me real quick. Perfect. Lastly, I'm going to be auscultating your carotid for any bruits. Okay. Perfect. Next, we're going to be doing a thorax and lung assessment. First thing I would do is I would record her respirations for 60 seconds. I would make sure that her effort throughout those 60 seconds is normal, that her thoracic cavity is fully expanding and contracting, that she's not using accessory muscles or having contractures to help with her breathing, and make sure it doesn't look labored. Just making sure that all that is good. Next, I'm going to be auscultating the breath sounds of her anterior chest first. And if you don't mind, just keep breathing for me, please. Then we're going to be auscultating all 10 regions. And while I'm auscultating her breath sounds, I'm gonna move forward, please. Just listening for any rhonchi, any wheezing, any crackles. And I'm gonna be doing that once again for the posterior chest.